Electroconvulsive therapy is by far the most controversial treatment in modern psychiatry. It is also known as shock therapy, but this is not an accurate title, as the patient is unconscious during the procedure and does not feel an electric shock. I will give you the pros and cons of ECT and attempt to convince you of its importance in medicine today. I know someone personally who underwent ECT with excellent results. ECT should be considered not just when all medications and talk therapy has failed. It needs to be given more consideration than just a last-ditch effort to help someone. ECT was first used in the 1930s. Images of one who flew over the cuckoo's nest are usually conjured up when someone mentions electroconvulsive therapy. At first, chemicals were injected into people with mental disorders to induce seizures. The chemicals were soon replaced by electrical currents. ECT was effective and there were no alternative treatments, so it was widely used before the introduction of antidepressants in the 1950s. During the early years, ECT was given without anesthesia or muscle relaxants, and the electrical current was much higher than it is today. The therapy was usually painful and risky. Violent seizures occurred to make the body thrash about with a great force enough to break bones. Electroconvulsive therapy is no longer like it was back in the old days. ECT today is a far cry from the old methods of the past. ECT therapy is generally administered in the morning before the patient has had breakfast. Prior to the treatment, the patient is given general anesthesia and a muscle relaxant. Electrodes are then placed on the patient's head. ECT is defined as either unilateral or bilateral, depending where the electrodes are placed. An electrical current is then passed through the patient's brain between the electrodes. This induces a seizure from about 30 to 60 seconds. Patients usually awaken 3 to 5 minutes after the treatment is over. For a period of up to 45 minutes, they may experience a period of acute delirium. They may be very confused, and some experience headaches, muscle stiffness, and disorientation. Patients' alertness and orientation usually return to normal over the next hour. Some of the common side effects of ECT include: it may be difficult to acquire new information. It is possible to lose memories that were formed right before the procedure takes place. Memory loss usually returns to normal within a few weeks. ECT does not change the brain anatomy. So why is ECT so controversial? According to Mental Health America, after 60 years of use, electroconvulsive therapy is still the most controversial psychiatric treatment. Much of this controversy revolves around its effectiveness versus its side effects and the recent increase in ECT as a quick and easy solution instead of long-term psychotherapy or hospitalization. Some experts recommend it be used only as a last resort because of the concern about permanent memory loss and confusion. ECT is generally recommended for persons with severe depression, accompanied with psychosis, suicidal intent, or refusal to eat. This is especially true if the patient is resistant to or does not respond to medications. It is also used for mania and schizophrenia when symptoms are severe or medications are ineffective. How well does ECT work? Normally, ECT is given 2 to 3 times per week for a total of 6 to 12 sessions. Studies have shown that ECT is effective in 85% of persons who undergo the therapy. According to in-depth report by Irvin Reddy, not one controlled study has ever shown another form of treatment to be better than ECT in the short-term management of severe depression. Research also shows that people who have received ECT were glad they had received it, felt safe having it, and would have it again in the future. Having said all this, I will now conclude with some closing remarks about electroconvulsive therapy. ECT works much faster than medications. On average, ECT takes 2 to 3 weeks to take effect versus medications that can take up to 6 to 8 weeks before improvement is seen. I personally know someone who underwent electroconvulsive therapy with excellent lasting results. He was suicidal, having tried multiple different medications with no effect. ECT saved his life. He is now living again, is a husband to his wife, a father to his children. ECT should be considered as first choice in the line of defense against severe depression and not a last resort.